I'm Dr. Christopher Barker, and welcome back to Holding Space. Uh, we've been talking about trauma for the last few episodes, and I want to branch off a little bit now and examine some of the factors that are associated with trauma, some of the implications, some of the disorders that can result in from trauma and in trauma. Let's talk about trauma-induced narcissism. Narcissism is one of those words that is very commonly used these days, and a lot of people have a general perception of it as being a person who is totally self-absorbed and often dangerously so. And there is some truth to that, but there's also a whole lot more to it. What's the implications for trauma? Okay, two things. First of all, can trauma induce narcissism? Can it cause it? And yeah, trauma can change how a person sees themselves. When a person's self-image or self-esteem is fractured or damaged, this can lead to feelings of shame, humiliation, or rage. These feelings are associated with narcissism. In fact, some researchers refer to these feelings as trauma-associated narcissistic symptoms. It's believed that the more personal a trauma is, the more likely it is to result in a narcissistic personality constellation or even disorder. Let's see what the DSM has to say about narcissistic personality disorder. They say it's characterized by a pervasive pattern of grandiosity, a need for admiration, and a lack of empathy. According to the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, individuals with NPD, and people will often refer to it by its initials. So you'll hear BPD for borderline personality disorder, NPD for narcissistic personality disorder. But you'll find 5 or more of the following. Grandiose sense of self-importance. This is not necessarily always the case. I'll get to that. Preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Belief that one is special and can only be understood by or associate with special people or institutions. A need for excessive admiration, sense of entitlement, exploitation of others, which exploitation is another one of those words we're probably going to have to define, and lack of empathy. Why focus just on grandiosity? Because that is one of the things that is often associated with narcissism. However, there have been some alternative explanations for how this disorder occurs. Gregory Lester, the psychologist who's contributed greatly to our understanding of personality disorders, refers back to the legend of Narcissus. In Greek mythology, Narcissus was a hunter, and he was known for his beauty, which was noticed by everyone. According to the best-known story of Narcissus, it's from Ovid's Metamorphoses, Narcissus rejected the advances of all men and women who approached him, instead managing one day to, wandering past a pool of water, fell in love with his own reflection, to the extent that he would not leave this and beat his breast in agony when he was not able to be united with his beloved, who was himself. And this is the sense of self-love that we associate with narcissism. However, it can also be self-hate. And again, if your sense of ego is damaged, then it can result in either a really, really positive mask of self-importance, or it can result in a glorification of yourself as the worst piece of trash in the world. Whatever it is that your image of yourself is, that is what you're in love with. That is what you're obsessed with. That is what you will go to any lengths to defend. And narcissists can often become enraged when they hear something to the contrary, or when someone threatens to leave them, which is why you often see very codependent, damaging relationships between narcissists and the people that they love or who love them. That's another term that we would like to talk about a little bit today, which is trauma bonding. Trauma bonding with the narcissist occurs when a person who has a strong need to take care of others is often paired with a person who needs someone to mirror them. They need someone to reflect them back, and they need that person to always be there. They will do anything to hold on to a person that they cherish, and we talk about how a narcissistic person will focus exclusively on rebuilding that person's character. We talk about gaslighting, and gaslighting is heavily associated with narcissism. A narcissistic person will convince you that it's your fault. They do much what the armed forces do, which is they reshape your identity. We can't, for instance, if you're a soldier, you can't take a moment to think about an order to charge. You pretty much have to follow orders. So your sense of individual identity is subsumed to that of your rank or to the member of the branch of service that you're participating in. So that's why you see movies in boot camp in which people's identity is stripped away and they're told, you're a Marine now and nothing else. That makes sense. You want to be able to follow orders. You want that to be your primary allegiance, your primary sense of identity. And such is the case of being involved with a person who's narcissistic. They want you to reflect them. They want you to mirror them. They will do anything to hold on to you until you've shown enough reason to be doubted that they will possibly cast you aside and look for someone else, often ragefully, which leaves the person who's been trauma bonded with a narcissist to be feeling left like they're left out in the cold and suffer much the same sort of narcissistic injury, as they call it, that the original narcissist had experienced. So it's a really complicated equation when you look at it that way. But it's also pretty straightforward. The problem is it's very hard to get away. When you have your identity stripped away and your main source of information. I worked with a woman once who her boyfriend, they never quite got married because he never quite could give up the adoration they would get from being single and being with an attractive woman. Before they could be married, he managed to tell her what to eat, what to wear, what to do. When she did finally get away from him and return to therapy, she was actually uncertain of whether she should keep going to school, whether she should keep with her college degree and pursue that career, because he had cast aspersions on it, trying to keep her in the place that he imagined her to be, which was his caretaker. It's really kind of it's almost like seeing someone who's been stripped of all their identity and they have kind of a blank look. Sometimes they have a very terrified look when they think about facing life on their own, making their own decisions. Who am I now? And why am I doing this? And what am I doing? Before, it's always been defined for me. This person always defined this for me. And it's very, very hard to break away from it. The reason you're kept that way can come from gaslighting in a number of ways. You're not capable of handling life on your own. Well, you don't know what you're talking about. I know what you need. I'll take care of you. Sometimes it starts out as very kind. It starts out as very giving and loving. I'll take care of you. You don't need anybody else. You don't need anything else. I'll do everything for you. I'll be the best for you. But that often turns to anger or rage if you look like you're going to step away. If you have someone whose vision of themselves is as trash or as a bad person or as an evil person, they will also sustain that image and they will also gather people who reflect that. You see, it's not that they're in love with beauty or power necessarily. That's the way it's usually defined. They're in love with the image, whatever that image is. And it can be anything that they choose. I have worked with people who have a narcissistic personality constellation and disorder. who really they dress in a slovenly manner. They seem like they don't care at all about themselves, but that's their image. That's what they want to perpetuate. And mirroring that is one of the therapeutic techniques that we talk about. And a way to get in is to say, yes, I see what you're trying to convey here. Therapy with a narcissistic person is really difficult, and after we get into some of the further implications of some of these personality disorders, we can talk more about the therapy. But a narcissistic person may not enter therapy. They will do whatever they can to sustain that image. And to enter therapy voluntarily and to try and change their life, usually they will come in at the request of their partner or someone who's involved with them. They will come in, and my best approach for getting someone like that to come into therapy is, will you come in and help me understand your partner? Will you come in and help me figure this out with her or him? The You have to work with what you've got. And if you understand the constellation, if you understand the symptoms, if you understand everything that you're seeing and why, then you can appeal to that and you can mirror that, and then you can get the person into therapy. They have to understand that ego is not all there is, that they can see themselves as more fully rounded, three-dimensional people. But I keep saying three-dimensional. Of course, everybody's three-dimensional, but in the sense of personality, fully rounded, I guess, is probably a better choice of terms. But you see, a lot of things, especially when it gets to the personality disorder stage, there's something critical missing. And that lack of empathy that I mentioned earlier is the primary thing that gets in the way of therapy. We have to have empathy for the people that we're working with. We have to understand a little of what they're going through. We have to understand what it feels like to be them. Not sympathy, but empathy, which means we have to step into their shoes a little bit. We have to be able to be other than who we are at the moment. We have to be able to be in that person's shoes. We have to be able to see the world as that person does. We need to be able to feel a little of their symptoms, to reflect that, to give something back to that, to speak to it, to change it. But again, if you're dealing with someone who doesn't have empathy, who doesn't have the ability to comprehend what we're experiencing or how we see them, they're going to have a very difficult time with change. Change comes with being able to step outside of the way you've seen your world and the way you've seen other people and have a new perspective. It's only with that new perspective that you can really make therapy work. Now, as far as dealing with a person who is involved with someone who's narcissistic, it can be contagious in the sense that as the narcissistic person has been damaged, they will damage you, and you will in turn be reflective of seeing narcissistic behavior everywhere. You become really good at it, and you can sort of see it everywhere, even where it is not. I once knew someone who she claimed her mother was narcissistic, and everybody she became involved with, if they did anything that she did not expect, if they did anything that was at all different from her point of view or contrary to her point of view, then she would call them a narcissist. Beware of anybody who calls everyone that they've ever been involved with a narcissist, because that means they've probably been damaged by one, and they see it everywhere, and they are unable to really form close associations. If there are any people watching this who have a narcissistic personality disorder, you're probably quite offended by now. And it's called narcissistic injury. That narcissistic injury is also used for any time that a person's worldview or self-esteem is damaged. But it's particularly poignant when it's applied to someone who really does have a narcissistic personality disorder. The effect of trauma on such a person is to create this shield, this mask, this sense of image that they must maintain. And they will do anything to maintain it, up to and sometimes including suicidal behavior. Trigger warning here, if anyone's concerned about suicidal behavior, we're not referring to normal situations. We're referring to a person that's pushed to the end of their limits. Their very sense of self is disturbed, threatened, sometimes fractured. And they will run, they will hide, they will relocate, they will go to the ends of the earth in order to save that image because that's what they cherish. There have been a few famous case studies of people with narcissistic personality disorder. And if you've got a person who has a narcissistic worldview and also is a little sociopathic, then we'll get into sociopathy another time because that one is definitely something that bears discussion. They will kill to defend their image. They will run, they will hide, they will damage others in order to avoid damaging themselves. The people that have become dependent upon them, the people that they have pushed into the role of being their mirror, can be broken as a mirror is if that person does not accurately reflect what they see. This is a brief view of narcissistic personality disorder and the types of things that can be associated with it. I will continue more on this when we get to different types of therapy. In general, therapy with personality disorders is difficult. Some people say it can't be done. I disagree with that. And I think that anybody who's willing to stick with us, the most important thing in doing therapy with any type of personality disorder or any type of serious disorder is forming that sense of bond, forming that sense of connection. And again, if the person doesn't have empathy, that's a little bit difficult. But if you are mirroring a person, if you are giving back that image, if you can let them know that you see them the way that they see themselves, or at least that you can understand the way they see themselves, then they will work with you. And I've had a great deal of success with people who can't connect with anyone else. But again, I can say, yes, I really see you. And for them to feel seen and for them to feel heard is really important. Anybody needs that. Everybody needs that at some point. Being able to connect, being able to form that therapeutic alliance so that you're working together on something, and you can start off small. But again, it differs with every individual case, with every individual person. I will deal with this more in a couple of future episodes when we talk about therapy, also when we talk about how personality disorders in general work, because they are in clusters, and I don't think we really need to be concerned with all the clusters, but we certainly do want to focus on the ones that they call type B. And this is one of them. Holding space is about being able to be with a person without judgment, being able to hold them, to be able to have an environment in which a person feels safe. And that's the type of therapy that we're talking about. It's also the way I'd like to approach the disorders and the issues that we talk about on this program. If you have any questions, or if there's anyone that you would like to see addressed, or anything that you would like to see addressed, you will find our email in the comments. And also feel free to leave a comment and ask about anything that you want to see. I appreciate people watching, and we will convene again soon. But in the meantime, let's hold space for each other. It's something that I think the world needs right now.